Meet Zola. She's active, healthy, and right now she's focused on her career and spending time with her friends. She doesn't talk about it often, but she hopes to start a family one day. Looking at her, you would assume everything is perfect, but an unseen threat has already slipped inside her body. It's acting like a silent thief, quietly putting her future fertility at risk without triggering any outward symptoms or physical changes. We often assume that feeling fine is the same thing as being safe. But when it comes to the hope of becoming a mother, hidden infections are the most persistent threat. Think of the female reproductive system like a well-protected home. The cervix acts like a tightly sealed front door, guarding the normally sterile rooms inside. But sexually transmitted bacteria, specifically chlamydia and gonorrhea, have evolved to slip past that seal and enter the lower space. When this initial entry happens, there is no immediate alarm. The bacteria don't disrupt the house or cause any obvious mess that would let a person know they've arrived. Once that lower doorway is breached, the entire inner sanctuary is left exposed to an escalating infection. Doctors call this Pelvic Inflammatory Disease, or PID. Looking back at our diagram, the bacteria are now multiplying. They move from the doorway up into the main room of the womb and eventually branch out into the narrow, delicate pathways of the fallopian tubes. A small percentage of women might notice a dull ache in the lower belly, an unusual change in their discharge, or pain during sex. But for the vast majority of women, just like Zola, the experience is completely silent. There is no fever and no pain while this invasion occurs. Because no alarm bells ring, a person goes about their daily life while the infection settles in and grows for months or even years. This silence is the thief's most effective weapon. It allows a common, easily treatable bug to transform into a long-term chronic condition. The body's immune system detects the intruders and launches an internal battle to fight them off. But this defense is aggressive and causes significant damage to the surrounding healthy tissue. As we can see, the battle leaves behind permanent scar tissue, forming web-like blockages that restrict these pathways. When the egg attempts to travel down the tube, it gets completely stopped by the webbing, leading to unexplained infertility. Sometimes the egg gets stuck in that narrow hallway on way to the nursery. If it tries to grow there, in that tight space, it creates a medical emergency where the tube can actually burst. For others, the scarring results in deep pelvic pain that never goes away. The infection itself is temporary, but it leaves behind permanent structural damage that changes a person's future if it isn't caught. This process can be stopped. The silent thief is powerless if we expose it early, long before the body's defense creates those scars. A routine visit to a clinic and a basic, painless test is all it takes to turn on the lights and catch the bacteria in the act. As the wave of light washes through our diagram, notice how a simple course of antibiotics dissolves the bacteria. This stops the invasion before any webbing or scars can form. By acting early, a condition that could have altered a person's life becomes a minor, easily resolved event. We can't rely on pain as our only indicator of health. If you are sexually active, routine testing is a normal, responsible habit, much like visiting the dentist to catch a small issue before it becomes a toothache. Using a condom consistently provides an external shield, preventing those bacteria from ever reaching the front door in the first place. By choosing to get tested, Zola is taking control of her health. She is making sure her future is secure. Your body is a sanctuary. Regular testing is the only way to check the alarms and protect your future from silent threats.